what are the career pathways in family medicine? The if nowadays there are DNB and MD programs available in family medicine. It is a recognized discipline, of course, I said. So, as specialist family medicine, you can always now government is contemplating on starting specialist position at community health centers, district hospitals, and subdivisional hospitals. And if you are a specialist, have a full qualification, DNB and MD, you can of course become a medical faculty also. And now we have 4 medical colleges running Department of Family Medicine. And due future, this is going to change, and more medical colleges will be having departments of family medicine. And of course, family medicine is one of the best thing and best uh, approach and best easiest vocation to pursue as independent practice. For any other specialization or super specialist course, you need lot of investment. You are bound to work in a hospital, but for family medicine, you can be just you can have just a small clinic. You can start with basic medical appliances and instruments, and you can right away start your practice. And nowadays, because of this interface of public health and primary care sector, there's a lot of opportunity in future coming in public health sector also. And you collectively, family physicians can engage into public health research and contribute to public health challenges. For example, this COVID pandemic, although a lot of uh, care is taking place as hospital for the serious and critical patients, a large number of them are being taken care, which are of milder kind, into the community and at homes. Now, in recent decades, the situation of the rural India has become better, and there is a boom in the rural economy because of the reforms in the agriculture sector, because reforms and development in the transport sector. Now, almost if you go across India, almost all villages are connected through roads, and there's a lot of funding through Panchayati Raj institutions into the rural areas. But one thing is not improving is healthcare. And if you are a family physician, practicing family doctor, you have a very good option to work in rural and remote area also, because there is a lot of demand. A lot of the generalist community-based healthcare systems you can take care in that setting. Many of our colleagues are also moving into the path of innovators and social entrepreneurs. Many of our colleagues and our members have started startup businesses, startup practices, or newer models of practices, where they are doing their practices on mobile applications. They are making technological interfaces available for home visits and remote digital consultations, as well as monitoring. And this all can also convert and develop into good enterprise entrepreneurship. And above all, you can be owner of your own destiny, because there are a lot of employment opportunities for specialists, but then still you are working under other healthcare institution, and it is very difficult to become an independent practitioner of your own. And this is relatively a different thing in family medicine, and it is easier to start career in family medicine. Now, conceptually, it is important to know what does the domains of knowledge of a medical experts are. Normally, we are concentrated on learning on the protocols of management of common clinical illnesses, and we are more focused on learning facts about treatments, latest guidelines, investigation modules, and all. But a medical expert has also to be a good communicator. Medical expert has to be a collaborator. As expert in family medicine especially, you have to be a good manager, you have to be a good healthcare advocate, because you also are representing your community, the community you are serving to. And there has to be continuous knowledge upgradation through CMEs, CPDs. And apart from medical knowledge, you are also encouraged to learn about other things like business management, law, ethics, legalities, finances. These all things help in your own practice and in your professional development. So a medical expert is just not a protocolist who is giving treatments and giving and writing prescriptions. It is about your overall development, and normally these things are not emphasized upon during our MBBS course and curriculum.